Hello, YouTubers. It's yours truly, Michele Cuke, midwifery student, going to talk about the self-breast exam. So the reason why this came up is because I met with my preceptor yesterday, and she was signing off some of the paperwork, and she asked me to explain a self-breast exam. And it was kind of haphazard, so I came home and I reviewed it, and I just want to make sure that I can share that with a client. So you're going to be my audience. All right, so there's basically two parts to a self-breast exam. It's looking at your breast and feeling. So we're going to start. We want to get a mirror and we want to sit or stand in front of that mirror. And obviously, our breasts are exposed. And we're going to look at them. And so, what we're doing is we're trying to look for something that's different. Now, breast your breasts are sisters, not twins, so they may not be exactly alike, but as you do this month after month, you'll know what your normal is. So you're going to compare one to the other, looking for any dimpling, any rashes, difference in the nipple. One could be pulled in a little bit. You're going to look for anything that would be different. So then we're going to get into different positions to try to see if there is a mass in the breast that might be adhering to the underlying tissue. So as we move our arms, it would possibly cause a dimpling. So one of them is putting your hands on your hips and pressing your hips in with your hands. What is that doing? That's tightening the chest. So we're tensing up that chest to see if there is a mass under the nipple that's causing a slight bit of dimpling. And it would be the same thing if we raise our arms. So we would raise our arms to see if there is adherence of a mass that's going to cause dimpling when we lift the breast tissue. So I'm going to lift up both of my arms and look. I'm going to put my arms on my hip and press in and see if there's any dimpling or changes that way. And I'll look at both sides. I'll come to the side and then I'll look at the other side, and we're looking for anything that's different or not your normal, which you will get to know. And then we're going to do the feel. So for many people, if you have big breasts, you're going to want to do this lying down. If you have small breasts, you probably can do it sitting. And we need a hard surface to press the breast against. And we're using, of course, our chest wall. But if I'm big breasted, I might not be able to, the bottom part might be hanging and it might be a little bit harder to get that area thoroughly. So I'm going to put my hand behind my head, and the purpose is to lift up that tissue on the chest wall, and then I'm going to check every area of the breast. So I'm going to use 3 fingers that I keep together and they're not apart, using the pads of the fingers. And I can go in circles. You could start here at the top and go in circles, making sure you're checking all of the area. So the breasts are lumpy, but you're looking for something that would be like marble or a pea or a walnut, something different. And then I want to make sure that I get under the arm. So what I started to do, omit that. We're not going to do this because it's a little bit harder and the lymph nodes are deep. And the breast tissue, we can check the breast tissue this way, but we really need to bring that arm down and relax it, maybe rest it on something and go up underneath, feeling for any type of lymph nodes. Okay, so make sure that arm is relaxed and you're able to push under, okay, and see if you can feel any nodes there. Also along the arm, you want to feel for any nodes. And of course, you would do both sides. Now, there are other ways to check the breast. Some people will go, like bicycle spokes. They'll go up and down like that. But I like the circle. So that's my preference and the preference of the video that I watched. So what if you find something? So I would check it 2 weeks later and see if it's still there. And then you would want to get it checked out by your healthcare provider. Check both sides, do it every month. Now, if you've had a lumpectomy, you still need to check your breast, any remaining tissue. If you've had a mastectomy, you still want to check the skin and the armpit of both sides. If you're pregnant or lactating, of course, the breast tissue is changing and you got milk ducts that are full of milk, so it's going to feel different. But if you do feel something that you don't feel comfortable with, you have to advocate for yourself and have it checked out. Better safe than sorry. All right, I think that does it.